Hello everyone, today we'll be discussing the fetal circulation. The fetal circulation is a system that is distinct and different from the adult circulation. So this intricate system allows the fetus to receive oxygenated blood and nutrients from the placenta. This system comprises of the blood vessels in the placenta and the umbilical cord. So we need to know that the umbilical cord contains two umbilical arteries and one umbilical vein. Fetal circulation bypasses the lungs via a shield that is known as the ductus arteriosus. The liver is also bypassed via the ductus venosus. Therefore, blood can travel directly from the right atrium to the left atrium via the foramen ovale. Normal fetal heart rate is between 110 and 160 beats per minute. When compared to adults, fetuses have a decreased ventricular filling and they have reduced contractility. At the cellular level, the yolk sac initiates erythropoiesis until the liver can take over at 5 weeks gestation. Thereafter, the bone marrow finally contributes at 6 months gestation. So initially, erythropoiesis begins in the yolk sac, then at 5 weeks it's taken up by the liver, then at 6 months by the bone marrow. The relative hypoxia when compared to the mother activates the hypoxia-inducible factor HIF1 to stimulate erythropoietin production in the kidneys, which improves the capacity of fetal blood for oxygen. Fetal hemoglobin also possesses a higher affinity for oxygen when compared to maternal hemoglobin. However, fetal tissue has adopted ways to unload the oxygen from the higher affinity hemoglobin in the fetal tissue by creating an acidic environment. By 4 to 6 months, the baby will have an adult hemoglobin level and no fetal hemoglobin. After birth, erythropoiesis also slows down. So, development. The fetal heart initiates at 22 days. This indicates the initiation of fetal circulation. Gas exchange initially occurs in the yolk sac until the placenta entirely takes over. This transition occurs around 10 weeks of gestation. Maternal oxygenated blood mixes with the placental blood, which is low in oxygen before heading out to the fetus. Due to this mixing, the fetus is relatively hypoxic compared to maternal arterial blood. As the baby is born, the cardiovascular system undergoes a quick and a drastic change. With the first breath, the baby's pulmonary vascular resistance substantially drops, which is in response to the oxygen now present in the lungs and the physical act of breathing. With the umbilical cord clamping after birth, the systemic vascular resistance increases, helping the blood flow towards the lungs. The ductus arteriosus has a left to right flow within 10 minutes. The smooth muscle in the ductus arteriosus responds to the oxygen by increasing calcium channel activity. That causes constriction and ultimately shunt closure. The increased systemic resistance also raises the pressure in the left atrium to be higher than the right atrium. Therefore, this causes the foramen ovale to close. Mechanism. The placenta connects the maternal and fetal circulatory systems. The placenta provides oxygen and nutrients from the mother to the growing fetus. It also removes metabolic waste and carbon dioxide from the fetus via the blood vessels in the umbilical cord. The umbilical cord develops from the placenta and is attached to the fetus. Oxygenated blood from the mother supplies the placenta. The placental membrane is where the mother and the fetus exchange gases and nutrients. The membrane is formed by the syncytial trophoblast, cytotrophoblast, embryonic connective tissue, which is the Wharton's jelly, and the endothelium of fetal blood vessels. Fetal blood flows through the umbilical vein to be distributed partially to the fetal hepatic circulation, but mostly into the inferior vena cava, bypassing the liver via the ductus venosus with an estimated oxygen saturation of 70 to 80%. From the inferior vena cava, blood travels through the right atrium of the heart to be directed across a shunt into the left atrium. There is greater pressure in the right atrium compared to the left atrium in fetal circulation. Therefore, most of the oxygenated blood is shunted from the right atrium to the left atrium through an opening called the foramen ovale. whereas a mixture of oxygenated blood from the inferior vena cava and deoxygenated blood from the superior vena cava becomes partially oxygenated blood in the right atrium. As a result, the estimated oxygen saturation of the left atrium is 65% compared to that of the right atrium, which is only 55%. Once the oxygenated blood reaches the left atrium, it travels through the left ventricle into the coronary arteries and the aorta, which branches to provide the most oxygenated blood to the brain before a shunt from the pulmonary artery called the ductus arteriosus allows partially oxygenated blood to be combined to the blood supply that will then flow to the systemic circulation with an estimated oxygen saturation of 60%. The partially oxygenated blood in the right atrium mentioned above can also enter the right ventricle and then the pulmonary artery. Because there is high resistance to blood flow in the lungs, the blood is shunted from the pulmonary artery into the aorta via the ductus arteriosus, mostly bypassing the lungs. Blood then enters the systemic circulation, and the deoxygenated blood with an estimated oxygen saturation of 40% is recycled back to the placenta via the umbilical arteries to be oxygenated again by the mother. So this is basically a diagram explaining it. Let's look at the flow chart. So blood from the placenta goes through the umbilical vein. It goes to the liver and it bypasses the liver through the ductus venosus. It goes to the inferior vena cava. Then from the inferior vena cava, it goes to the right atrium. From the right atrium, it goes to the right ventricle, as well as through the foramen ovale, it goes to the left atrium. So the right ventricle takes blood to the pulmonary trunk takes to the lungs. From the lungs, it goes into the pulmonary veins and then into the left atrium. Then blood from the left atrium goes into the left ventricle. From the left ventricle, blood goes into the aorta. And from the aorta, it goes into the systemic circulation. From the systemic circulation, it goes into the umbilical arteries and then back to the placenta. So that's all about the fetal circulation. If you like the video, please like, subscribe and comment. Thank you.